All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. And yes, I miss France as well. Where has she been for a few days? D Diaz is first today. Hey, D Diaz. And D Diaz, this is really good. Today was the lazy lazy people's day, because it seemed to be my day. So good. Dr. Z is here. Hi all, good to be here. Thank you very much for being here. Simple Garden is here. T Hunter is here. Texas is here. Algebra Bean is here. Loretta is here after a long time. Is this the correct stream? It is the correct stream. John Snyder is here, and a lot of folks. Genesis is here. So Genesis, you have a question. Let me look at that question here. So Genesis says, question, in the study I read, it said that lymphocyte and platelet count transiently decreased and the CRP increased after vaccination with Pfizer. What mechanism caused these transient response? So can you share that study with me as well? I'm just going to theorize, and I might be wrong. So the platelet count reduction means that platelets are used up. If they are used up, that means there is inflammation going on, and they are, for example, here or maybe in the blood vessels. I don't believe it is in the blood vessels, but let's just theorize. And that could cause platelet clumping and platelets to be reduced. Now, for the WBCs to be reduced, that is an interesting one, because vaccine is not supposed to be a virus to go and destroy WBCs. So why did the white blood cell count went down? One reason, once again, could be that they got used up. But why are they used up by Pfizer and not Moderna and not others? Or maybe this study only looked at Pfizer. So if I have to look at the study. Now, why is CRP high? That is normal. So whenever we have inflammation, the cytokines that are released from the cells that are inflamed, and from the fight that is going on, and the cells that are taking part in the fight, those cytokines, interleukins, cytokines, they will go and act on the liver and ask the liver to generate acute phase proteins or helping proteins with the inflammation. C-reactive protein is a type of inflammatory protein that is released by the liver to help contain the inflammation. So that increases fine. Hello, hello. Denise is here as well. Hello, Denise. Oh, Roman is here. Hey, Roman, how are you? Long time no see, huh? Lev says, how does COVID nucleocapsid antibody test work? Is there a nucleocapsid antibody test already there? If it is there, the functioning should be very simple. So let me share my screen and we'll discuss it. So what happens is, nucleocapsid usually means if there is some RNA or DNA and there is some protective material around that genetic material, that protection is called nucleocapsid. Imagine it is just some of our, just like our brain is inside the skull. So the skull will be called a nucleocapsid. Just same way, the genetic material for a pathogen, when it is inside this proteinaceous material, that is called a nucleocapsid. And we can make antibodies against that nucleocapsid as well. And then to detect those antibodies, we can say there is COVID infection. So SNC Nutrition says, Dr. Bing, can you take the Moderna vaccine and follow up with ivermectin once a week as a prophylactic? And how long would you have to wait to start the ivermectin after vaccine? So SNC Nutrition, I took Moderna and I kept on ivermectin before, during, and after. So can you take Moderna vaccine and follow up with ivermectin? Yes. Can it continue to be 1 week? Yes. I have reduced 1 week prophylaxis. I now take ivermectin when I feel that I may have become exposed. For example, went out somewhere and I saw someone, let's say, come too close to me, or I touched something and inadvertently touched my face and didn't think. So there are many such cases. For example, I went to Starbucks, and I usually When I'll bring the coffee, I'll spray it with um, those sprays and clean it and then use it. And one day I just picked it up and started, got it from the barista and just started sipping at it. And so that was a miss on my part. And so I took ivermectin. How long would you wait to start the ivermectin after vaccine? So I am not a believer of ivermectin needs to be stopped. This is a rumor to say ivermectin should be stopped because there is no mechanism in ivermectin that would dispel vaccines behavior. And this is where the confusion comes, that people say, well, if ivermectin can help fight the virus, then vaccine is going to act like virus, and why does it not fight with the vaccine? And just very quickly, I've done this discussion. So imagine here are two cells. We have injected a vaccine here, and this is a coronavirus here. And now let's say ivermectin is here and ivermectin is here. Let's see how does it work. For coronavirus SARS-CoV-2, it has to connect with ACE2. And to bind with ACE2, it's going to have the spike protein bind with it. And ivermectin can actually hinder this. Now, in case of a vaccine, the droplet is going to get into the cell and there is no ACE2 binding. So there is no hindrance here. Then let's say, again, diagram A, diagram B. In the A, let's say the virus has entered the cell and now it has released the messenger RNA inside the cell. Now that messenger RNA will produce an enzyme called RDRP. That is a viral enzyme. The vaccine would also have messenger RNA, but vaccine will not have RDRP. So here ivermectin can disrupt RDRP, but here ivermectin cannot disrupt any RDRP because the vaccine does not have an RDRP. So no issue on vaccines mechanism. Then on the virus side, there is a 3-chymotrypsin-like protease enzyme, which is also a viral enzyme. And here vaccine does not have that. So ivermectin would not disrupt anything, and here it would disrupt. On the diagram A, it will disrupt 3-CTL. Then the virus is supposed to use the importin alpha and beta in our cell, and ivermectin hinders or stalls that. Here the vaccine does not use importin alpha and beta, so ivermectin doesn't do anything to vaccine's function. And finally, ivermectin causes modulation of nuclear factor K beta or KB, kappa B. Here, nuclear factor kappa B would also be affected, and ivermectin will modulate that. So that means it will reduce inflammation a little bit in vaccinated person, but it would not get in the way of the vaccine's behavior. The same is true for adenovirus-based vaccines as well. Ivermectin has no mechanism to disrupt an adenovirus itself. So I hope that answers that question. Hugh Fonzo says, should use the FLCC outpatient protocol if I get COVID even after I got Moderna in January. I think that there is a very good set of medicines in there. Maura Gallagher says, what benefit for a healthy 21-year-old female from vaccination? So we have done this discussion before as well. From data point of view, it seems like those youngsters that have comorbidities, they benefit more from the vaccine compared to those youngsters who do not. Most of the youngsters in this age actually can handle and survive the virus much better. But I have always been very careful. This is the data, the decision and choices are yours. Keith says, I'm actively trying to get exposed to COVID and subsequent variants often. Is this dangerous? Yes. My strongest symptom so far, loss of sense of smell. Come on, Keith, what are you doing? Well, get your antibodies tested. If you have gotten the antibodies, then please stop getting exposed. This is not a good exercise. And loss of sense of smell does show that you got exposed at some point. Stop. If you just wanted to be exposed to make sure that your body can handle it, I think you may have handled it. Don't expose yourself more. GH says, what do you think about spacing the second dose of the Pfizer vaccine longer than 3 weeks? Would it be possibly cause less side effects for the second dose? So the data from UK is the best for these longer periods of longer duration of the short distance. And they actually see that the first shot continues to improve the efficacy up to, let's say, 80%. And then second shot would bring it further up. Now, in terms of less side effects, it is possible that the immune system is kind of in a resting state for COVID. And then when the second vaccine is given, second jab is given, immune system would take a couple of days to wake up. There could be still an overwhelming response, but there may not be. If you ask me from a mechanism point of view, I think it would be the same, because immune system's job is to wake up and respond. And when it is going to respond, it's going to respond. Jodi says, trying to figure out how to get my 16-year-old J&J because myocarditis with Pfizer. If he's not allowed J&J because not 18, take prednisolone after or Advil. So here is how I will suggest. Again, not an advice for the child, but generally, instead of covering from the day of the vaccine with the medicines to a point where you are not even aware something happened, I would say low dose of anti-inflammatory and low dose of steroid, just to make sure that if there is something that is going on, we become aware of it. And then if something happens, that is when the full protocol for support should come in. Otherwise, what can happen is that the problems can become masked and delayed, and that can cause, I think it would be okay, but I would hate to mask something which might pop up a few days later. But yes, there should be prednisolone, low dose, Advil. Yes, I took Advil for myself as well. And I actually took anti-allergies too. Although the nurse who gave me the vaccine was upset that why did I take all of those? And I said, oh, I'm really very sorry. And I said, do you not want to give me the vaccine? She said, no, I'll give you the vaccine. So Joshua Grimes says, from the current vaccine that are available and Novavax that might be available in September, would you wait for Novavax if I had questions regarding potential long-term effect of messenger RNA vaccine? So Joshua, my decision, look, I didn't wait for Novavax. I wanted to have Novavax, but I went ahead and I took whatever vaccine they had. So if you put me in this shoe, I would take vaccine once again. So that's the way I would do. It just reduces the risk. Robin Hope says, do ivermectin tablets taste slightly sweet? I hope I didn't get shipped sugar pills. The packaging looks very legitimate. So I have not tasted them to be sweet. But that may be just difference in packaging or me not trying to taste them. I can try one today and see. How about I go get it right now and try it and see if it is sweet or not? So give me 1 second. My apologies. The ivermectin has been misplaced from there. I'm sure somebody from my family took it. So I'll have to find it separately. Robin, please tweet at me and I would take one pill and taste it. Is France here? Douglas says we for France. Is France here? We were missing France today. Okay, so Doug is doing we for France. Okay, Doug, thank you. Paulette says, would a person with autoimmune disease best benefit from ivermectin or vaccine, and how is Luffy tonight? So the person would benefit from both ivermectin and the vaccine, and I'll show you Luffy. So once again, get ready for a camera jitter. So here I am, and let's see, I'm gonna turn this off, and let's see. Do you see Luffy over there? So once again, sleeping next to me. He is generally much better. Today my wife was saying he's not becoming as sleepy as he was becoming before, because he kept doing naughty things after the medicine as well. He's on fluvoxamine. How do we get ivermectin? Should we worry about sending 5-year-old to school? So children's decision is difficult. If I was the one and I had younger children, I'll probably be not sending them, or will be sending them with lots of care and maybe ivermectins and those. Now, how do you get ivermectin? Please go to, let me share my screen, and if we go here, so if you go to flccc.net, here, if you go to ivermectin, how to get ivermectin, and over here there is a list of doctors who may prescribe you based on the situation of ivermectin. So FLCCC. Luffy's got it. I think he's holding it. It is possible that Luffy has hidden the ivermectin somewhere. Secret Owl says, go to Odyssey, watch the real videos of real people and their side effects. YouTube deletes them, so go to Odyssey. So I am on Odyssey as well. So every video within a few hours, half an hour, goes to Odyssey. Those that got censored before moving to Odyssey are still not there. CJ says, if adenovirus from vax persists for up to a year, is it only in deltoid where it was injected? Effect on immune system, still producing spikes? Will ivermectin help? Question. So good question. And my wife had Johnson & Johnson. And she still has ups and downs, very less now. Even today I was talking with her and I was saying, do you feel that you are better than before? And she said, yes, a lot better. What was it that she was complaining recently? I think she was complaining of fatigue recently, but has really reduced her complaining. In the beginning, she used to be very, very sleepy or drowsy or fatigued or joint pains. And this is about 4 or 5 months now. According to J&J, this vaccine continues to produce antibodies for 8 months. Now, your question that where is the vaccine actually living? I do not know if it is the vaccine that is doing this. Vaccine is probably gone. It is the immune system cells that are sitting in, let's say, bone marrow now, or other inflammatory area, which includes deltoid. The memory cells, they live in the area of inflammation where they were formed first, or because of which they were formed first, and they live in the bone marrow or lymph nodes. They could live in all three places: area of inflammation where they got started, lymph node, local lymph nodes, and other, and the bone marrow. So it is probably the memory cells that are still triggered, and the number of them is more, and so they continue to make antibodies. So let's see, is it only a deltoid? So not just the deltoid, and it's not the vaccine, it's the memory cells. Effect on immune system effect is it's just continuing to make antibodies for some more time. Still producing spike? I don't think so. The spike production or the adenovirus removal should occur fast. Still, let's say adenovirus becomes, the DNA from the adenovirus becomes part of our nucleus, and our nucleus is unable to delete it. If that is the case, then that cell will be destroyed very soon as well. So it is very difficult for this to live on for months. It is a couple of weeks and it is out. Vishwadeep Singh says, thanks for helping. My parents are 50 years old and fully vaccinated. So how the ivermectin cycle should proceed? For folks who have vaccination, maybe bi-weekly or monthly prophylaxis, bi-weekly if you're in a hotspot, even weekly if you're in a hotspot, and if they get exposed, prophylaxis on that day. That's what I do. So Soma and Sirjoy Ghosh says, we know that the genetically modified adenovirus, INVAX, like AstraZeneca, is sent to fetal cells where they multiply, but why do spikes are not formed in those multiplied cells rather than the adeno go to our cell? Okay, so let me see what you're saying. I I thought of fetal cell in a different way. I thought we're talking about fetal cells in pregnant women. You're talking about fetal cell where the virus is built. So the question is, uh, adenovirus in vaccine like is sent to fetal cells where they multiply, but why do spikes are not formed in those multiplied cells rather than the adeno go to our cell? Because when the adenovirus is being made there, the cells that are in the, let me share my screen. It's a very good question. I like such questions. So what happens is that, where is my pen? So let's say this is a factory fetal cell. And here we have sent the messenger RNA to make adenovirus. And then the adenoviruses are formed here. The thing is this factory is sitting in a dish where there are no immune system cells. So there is nobody who is attacking this cell and killing it. So even if the cell exposes some parts of the adenovirus on it, there is no T cell or helper T cell or cytotoxic T cell or B cell to attack the cell and kill it and to attack the adenoviruses and kill them. It's just a factory with safety. So then we kill these cells to break open like an egg and get their adenoviruses out, bottle them up, and then inject them into our system. When we inject them into our system and they enter our cells, then inside the cell they are still safe, right? That is why they are there and they bring the DNA to the nucleus. But then when we start making spike proteins and those spike proteins appear on the surface, that is when the immune system responds and the immune system then starts working. So this factory doesn't have that whole immune system mechanism. If you put the B cells and T cells and provide the enough correct cells there, they would destroy it. Good question. Nania says, so much misinformation on comments. Do you mean in comments? Secret Owl says, Peter McCullough is expert at vaccine adverse reactions. Mr. Bean, of course, you are awesome. Thank you. Carol Raj's mom says, how long before the world powers that be start controlling the distribution of ivermectin? I read WHO is focusing neglected tropical diseases. To me, that's code for we are cutting you off of. They have already started saying that ivermectin should not be given and we are short on short supply and so on. They might soon start controlling. I do not know how long. I know it's a rhetorical question as well. Tika says, Pierre Corey says ivermectin not working in hospitalized patient, and it is possible for. So yesterday, Paul Wolf left a comment to say why is Delta not more lethal if it is causing more viral load? And I promised I would discuss it. It's the same problem here as well. So maybe give me till tomorrow and I would discuss that in detail for how Delta is more aggressive. HumbleBeen says, would a third dose put someone at risk of autoimmune issues, inflammation? So depends who the person is and what is their situation. For example, an older person or a person with the let's say immune system not working correctly or immunosuppressed, whatever, regardless of the age, they may benefit from a third dose because the first and second dose may not trigger the immune system that much. And then in some youngsters, even one or two doses are sufficient, and then giving them a third dose would only cause more side effects. Jack says, I'm not interested in having spike proteins injected into my body. Got it. Eric Dog is saying, Loretta, all good. So, Eric, hope you're well. Michael, thank you. Critics of ivermectin point to one study apparently withdrawn from the recent meta-analysis. In your view, what is the most convincing study to counter that? I actually have never been looking at the studies anymore. Do you know why? And I have mentioned that before as well. The patients that I manage and I use ivermectin with them, I have never been disappointed, even till to date. So I don't care for the studies and what is retracted and what is the politics that is happening. I care for this works and I would continue to use it. That's how I look at it. That's why you may not have actually seen me with more studies. I'm done with the idea of, I was the one somewhere last March, April, when I discussed the ivermectin works, or sometime near that. Afterwards, a few months later, Dr. Paul Marek had looked at my video, and then there is a ball rolling for FLCCC as well. But I've been using it with lots of success. Good question. So Maryesta says, what was the median age of vaccinated death from May to August? So we discussed that, Maryesta, that they did not disclose that. And it may be that that data is sitting somewhere. The data that I saw, that data does not have this part in it. So that was my curiosity too. So I'll have to do some research to get that data. Keith Alderson says, Stephen, Dr. Bean does cover the natural immunity as well. I think it is just that hasn't come up yet. Yeah, so natural immunity is actually at par, or in some studies more robust than vaccine induced. The thing I would continue to say, and I always say it, waiting for infection, just like today's Cool Bean said, I was deliberately exposing myself to COVID. COVID can cause death as well, and we do not know who would die. And because of that, at least I am not the one who would say I want to be exposed to it. And when I feel that way about me, then I try to protect everyone in the same way. Melissa says, what's your opinion on polysorbate 80? I do not know. It has been shown to abruptly change heart function, blood clots, stroke, heart attack, heart failure, and death, which has been happening with COVID 19. Melissa, I haven't heard of this, so I'll have to do some research. So Humble Bean says, for young men considering vaccination but willing to avoid inflammation, could you share the pre-post vax protocol to avoid issues? So if Rima is here, she has been asking me to do this video for a couple of days now. So the first, young men messenger RNA-based vaccines have been shown to cause more cardiac inflammation. If that may be the case, then low level of, again, cardiac inflammation is something that one should not try to handle that at home. It has to be in the hospital. This is why I just answered before that please don't try to mask it by giving some medicines and then you don't even know, and if it becomes an emergency then we are in trouble. So ideally anti-inflammatory steroids and maybe even ivermectin may be useful, but the best thing is these could be useful just to keep, but then one, as soon as any chest pain occurs, one should go to hospital, and this should have been planned out before. This is a very serious thing. Although it is rare, but still one should be ready. Brady says, is itchy skin a symptom of long hauler? Yes. So when the long haul can cause cytokine and inflammation, that inflammation can cause arthritis or the inflammation of blood vessels that can then cause under the skin, if it is happening, that can cause itching. Direct skin irritation can occur as well. Gazar says, I did not realize how many armchair medics there were until COVID. So it's not just the armchair medics. There are actually, it was so funny, a couple of days ago, somebody left comments under my videos. Nowadays, I do not look at a lot of comments, but anyway, somebody had left a comment, error number 1, and the whole mechanism was wrong. And they said, you didn't get this and you were wrong. And here is the actual mechanism. And the mechanism they put was some conspiracy theory mechanism. Then they said error number 2, and then once again wrong mechanism there. And then at the end of this, they said, I am surprised that you being a doctor cannot understand these simple mechanisms. And so it's just, yeah, everybody is a doctor. Tika says, my sister had the virus and went and got first Pfizer dose, 32-year-old healthy, should she got SRV? What is SRV? If she got the dose, do you mean second? First dose I've seen works fine for many folks. I'm not very clear about the second one. Gold Country Russ says, Dr. Bean, Sunday I emailed you to your business info site a link to a video. Have you looked at it? No. Business info I don't see. It is usually an outbound. Can you please send it to support? Apologies for that. Heriberto says, I'm a teacher starting school on Thursday, have Moderna shot, take ivermectin as prophylaxis weekly, and take the Zelenko quercetin protocol. Can I stop worrying about getting sick? So see, it is very difficult. I still take these things and I still worry that I might get sick. But this is, I would say it this way, if you add vitamin D and those things as well, this is the best we can do at this time. In addition to that, hand washing, mask, social distancing. Now you're going to be amongst the children who may not even know that they have it, and they might give it to you, or they might even take it from you and give it to others. So it is a risky situation. These are the best things that can be done. Vaccine is taken, ivermectin is there, hopefully vitamin D, quercetin. There is nothing else other than mask and social distancing. So good luck. I think you'll be fine, but what can be, I think this worry is going to stay on for some time. Joshua says, if vaxxed people can still get infected and they can still shed the virus, from the time they get infected to shedding, can the virus mutate and become a different variant and then escape the vaccine? No. This is a very good question, and I've discussed it a lot because this is the question that started off with one of these theorists who said that the vaccine would kind of cause the mutation. So if you think about this, vaccine will not cause the mutation, neither would it give actually a chance to the virus to live and mutate. Now, can the virus mutate in general? Yes, that can happen in vaccinated and unvaccinated. Lesser chances for vaccinated because the immune system would very quickly attack the viruses. For unvaccinated, it would be a little more time because their immune system is getting ready. So no, this is just a rumor. Secret Owl says, my wife has blood-brain barrier problem. Is ivermectin an issue? Yes. So if blood-brain barrier issue is active, for example, somebody has meningitis or somebody has active stroke, just had a stroke and they're recovering, or some other such situation where blood-brain barrier is just injured, or there is inflammation, or there is some other such issues, then it is contraindicated. Igi Pop says, could Pfizer and Moderna make their vaccine safer by slightly modifying the messenger RNA spike protein? They could upgrade them towards the latest variants. In terms of safer, if you say that, hey, could they, for example, receptor binding domain, they can modify it further. Yes, they could. That could give rise to incorrect antibodies as well, that might make the vaccine less effective. So, Art Patron, this is actually correct, although I'm not a big fan of Dr. McCullough, but um, this much of the thinking is correct. The reason for that is very simple. Delta variant spreads faster, it not multiplies faster, it enters the new cells very fast. And because of that, it would spread in the body fast. It would cause tissue damage in larger number in shorter period of time. That means if we don't get ahead of it fast enough, then it won't give us enough chance and it would cause a lot of damage very rapidly. And then getting ahead of that, we already know, is difficult. Disaggregate plasmatoid says, so there is no evidence that vaccinated are getting less cases proportionally to unvaccinated. You said there are no real numbers for this, right? No, I just discussed the numbers. And the numbers show thousands of fold less hospitalizations and deaths compared to what is happening in unvaccinated. So I do not know how I ended up giving this message. Just watch that video before and just look at the numbers there. I kept saying that the cases numbers are something that we cannot trust. And the reasons are two. Number one, generally, case means we have identified someone with PCR positive. Now, sometimes PCR can be incorrect. Sometimes people would just not get their PCRs. Some places would not test enough. So saying the case numbers are exact is incorrect. Then if you look at CDC, that they are defining the case to be somebody after fully vaccination ending up in a hospital or dying. That is their definition of a breakthrough case. That is not the definition of a case for others which are not vaccinated, for example. Over there, any PCR positive is a case. That means comparing case to case is an incorrect comparison. The correct comparison, or more closer comparison, will be to see hospitalizations and death. Iggy Pop says, thank you, you're welcome. Paulette says, do I need to take ivermectin dose at once or can I divide it into several doses throughout the day? You can divide it into several doses. The half-life is 18 hours. So if it suits you better, maybe 2 or 3 times. Art Patron says antibody mediated viral enhancement is term I hear recently. Is the same thing as ADE? Correct. So the uh, I have done a video, and it is interesting that folks don't look at that video often. But so maybe if we say Dr. Bean ADE, so there is this cytokine storm with ADE, then do COVID-19 vaccines. Where is the this one is another ADE mechanism and various mechanism. Wow, YouTube has done a great job of actually breaking down the various mechanisms I discussed in ADE at various times. So
healthcare is backwards. Everyone knows it, but it's not for the reasons you think.
So cytokine storm with ADE, antibody dependent enhancement of coronavirus. So I did that in January 2021. So that there I have actually discussed all mechanisms of ADE. So yes, Art Patron, that is what one of the mechanism is antibody dependent enhancement. Roman has a good point. FLCCC protocol failing and needing a bigger dose might also be affected by possible fake lufimectin circulating in the supply. That's true. So RW says, friends, please tell me where I can get ivermectin in California. Is it only from FLCCC? No, so your doctor could decide to prescribe you um, ivermectin. You just have to find a doctor who would be willing to do it. The doctors who are on FLCCC, they are the ones who are open to prescribing it, but there could be many other. HumbleBeen, I do not know the answer to this question. What do you think of the presence of aluminum hydroxide adjuvant in Valneva inactivated wax? It will improve immune reaction, but it is very heavy metal known to be toxic for humans. That is correct. And I discussed the inactive virus and we talked about aluminum, and we talked about aluminum being an adjuvant that would cause the immune system to be triggered. Although the amount of aluminum is not big enough to cause, let's say, renal damage or damage like that, it is a one-time amount, very small quantity. It's not a continuous intake of aluminum. So I would not worry about that. My worry is mainly the adjuvant being so strong that immune system overreacts and then people develop side effects and long haul kind of things. Logic is here after a long time. Logic, how are you? Uh, Vinoth has a good question. What is the daily recommendation of vitamin D and zinc? So the zinc and quercetin, just the recommended RDA, which is on the bottle. For vitamin D, ideal is to have 39 nanogram per milliliter levels, and if those levels are not met, then you might need to have a higher dose of vitamin D daily to reach that level. Once you are above 39, then it's up to you to go back to normal or 5,000 international units or 10,000. I have been taking 10 to 20,000 international units because my level were at 19. Then they became okay, and I went back to normal, regular. So Joshua Grimes says, have you looked at Covaxin and what are your thoughts on it? I think I have, and I did a talk about it as well. It's a good drug, a good vaccine. I actually, so I think there is a Covishield and there is Covaxin from India. I believe Covishield is AstraZeneca and Covaxin is the inactivated virus from the Serum Institute. And I loved it. Somehow people say that the data shows it is less effective, but I like the inactivated virus vaccines. with the COVID, the only scare that gives me is that what if the inactivation is not correct and there is some active virus sitting somewhere? The real McCoy LLC tributes artist says, are the vaccinated infecting the unvaccinated? No. They both are just infecting each other based on if they have the infection and they are near each other. But no, not one way. So Amy says, so if Novavax want to get approval, they'll have to do full approval, which will cause them. Yeah, so that is a problem. And I feel that Novavax is not able to get to the authorization or now approval state. Dante says, so as a conclusion, ivermectin is much safer and effective than any vaccine? No. Myself vaccinated first dose Sinopharm. Thanks a lot. Yeah, no, so that's not the conclusion. We just talked about 160 million people in the US vaccinated, and they have a good outcome. Ivermectin has a very good outcome as well. I don't think that these are and or. I think they are and together. They're not. I don't think that this is fair to say ivermectin only is the answer or vaccine only is the answer. Bill Gates, Dr. Bean Medical Lectures, please help me, Dr. Bean. My wife left me because my private are Microsoft. Okay, tell me, how do I help you, Mr. Bill Gates? Uh, Jane says, thank you, Doctor. I appreciate that you're doing. I understand these are very tentative times we're living in. Yeah, these are interesting times. Matt Jake says, the outcomes of the vaccine isn't clear to anyone. I think, Matt, just watch the video before this video, and if it is still not clear, then I don't think that it will become clear. Nikki says, is the CDC study date limited, for example, hospitalization, death within 30 days of being considered fully vaccinated? I do not know what is their definition, but UK has been using within 28 days. Here, the deaths that they are counting a case is counted as 2 weeks after the full second dose, or whatever is the vaccine manufacturer's recommendation, 2 week or 1 week. Various vaccines have various numbers. They use that as a case. Then death is counted just as any other COVID-19 based death is counted. So the same formula. There is no additional formula. TD says, have you emailed Dr. Corey about his alarming tweets? No, I have not. I was actually thinking of talking with him today, but I forgot. I was working on this, collecting the data. Bill Gates, I hope you're not crying. HumbleBeen says, what is the age at which risk benefit becomes positive for taking mRNA vaccine? Thinking of young people, so above 30 in men, and women, I think almost all ages. Do you think waiting longer between the two doses? I would like to wait longer. But just to be sure, I have taken both my doses at the regular interval. So I hate it when some doctors would come in and they have done something, but then come in and say, you should not do this, unless they are drastically affected by what they did. Anthony Di Stefano says, does ivermectin help with S1 infection of monocyte and other blood cells? Yes. If so, how? Because ivermectin binds with S1 piece. So ivermectin can actually get into the cells, bind with the S1 pieces, and that way it can help. And number two, it reduces the inflammatory nuclear factor K beta, which is a part of the infected monocytes' behavior. So it kind of modulates them. So good question. Matt says, you're quickly losing credibility. Please reconsider. Reconsider my own credibility or reconsider my positions. I am totally fine with the credibility. I actually have never insisted to say, give me credibility. I share information that you like it, fine. You don't like it, fine. You find me credible, fine. You don't find me credible, fine. So if you don't find me credible, this is not a place for you. The good news is that even when you don't trust me, all the talks that I do, I have references. So you go to those references, you read them up by yourself and make your own decisions. But if your decisions have been made by someone else, and then you want me to change my decision so that it can be aligned to yours, and that's not going to happen. To give you an example, it cracked me up. There was a cool bean here in the comments a few months ago, and he had, his name was I am not a sheep or something like that, and he, throughout the discussion, he just kept saying, why are you following others, and why, open up your eyes, and blah. And at some point, uh, I pointed out some mistake in his he was talking about some mechanism, and I was cracking up because to respond to that, he said, I am only following this doctor. And so all of a sudden, the person who was saying, don't be a sheep, himself was a sheep. So I think we all have to figure out data and points from somewhere. What I do is, whatever I have as the basis of my talk, I present that this is the data. You can go look at that and say, I don't like it, and then you can discard what I'm saying, or you can go and find it and interpret it differently or the way you want. So I don't come in here to say, let me go and build my credibility, or let me go and save my credibility. The best way to save my credibility will be to never talk. So then there will be no point and no issue with the credibility. So I don't care for this. So LL Hannah says, didn't they already prove virus mutated around monoclonal antibody treatment? Actually, Hannah, this is a not mutated, but some newer mutations caused it to make monoclonal less effective, because monoclonal is one clone. It only attacks the virus on one place. So it is really easy for the virus to escape that. This is why I like Regeneron more, because that is a polyclonal, and really two, but still better. Bill Gates says, Dr. Bean Medical Lectures, I want my hard disk back. Melinda gave me so many STDs, I had to install Norton antivirus. So, on talking about the antivirus, somebody sent me a meme last year which said, so somebody was praying to God and saying, this year has too many viruses in it. Can we reinstall and redo something? So that was funny. So Lights got me first Pfizer a week ago. Can you increase the interval between the two shots longer than the CDC recommended and still be valid? That's a very good question. I have no idea. That's a very good question. For example, somebody decides not to go for after 4 weeks and goes after 12 weeks. Will they call it second dose, or will they say that is the first dose and now you got to come in for a second dose again? That is a good question. I do not have the answer. Keith says, it seems Dr. Fauci is expecting the FDA to give shots full authorization by the end of this month. Good, bad idea. Are deaths, illness low enough to justify this? So I actually think I read that and I thought, oh, that's a good idea, because once it is a fully approved drug, medicine, remedy, vaccine, then it is open to people saying it is working, not working, legal recourse, and all that. So it will be good for them to approve it. The data actually shows, the data that I discussed today, that shows very good effective outcome with vaccines. Kanchan, thank you very much. So Rizabit said, I got my first Pfizer jab today. They said you can wait an extra 2 weeks. So extra from the original time. So for example, 4 weeks is you come back after 4 weeks. So you're saying that they said 6 weeks is okay as well? So Joshua, that is how the thought should be. That if they're fully approved, then they have to do the phase 4 and they have to be able to be liable. In theory, I hope as part of approval, they do not ask for a clause that says, you're giving us approval, but indemnify us as well. That will be sad. Michelle says, should statins be taken during the acute phase of COVID? I'm reading about the immunomodulating and perhaps immunosuppressive effect of statins. Statins have been very useful. I am not a big fan of statin during the acute phase, but FLCCC has statins in the acute phase. Bill Gates is funny today. Saucerful Bear says, friend recently developed a severe infection in his neck soon after he was vaccinated. He is 30 years old now in a coma and diagnosed with spinal meningitis. Could vaccine be the cause? No idea. Without looking at the labs and the history and what is infecting him, can't say. It would be very irresponsible of me to say yes or to say no. Joshua says, I had COVID back in January, just had antibody test, it was positive. Very good. Also ordered T detect, still waiting. Well, you already have antibodies, and I believe that these are above the threshold. Threshold may be 5, 6. So 240 is good as well. So yeah, it's good. Looking for questions. Anthony says, Saint Augustine said, truth is a lion. Do not try to defend it. Set it free and it will defend itself. Thank you, Dr. Bean, for your wonderful work. The world is a better place because of you. Thank you very much, Anthony. I love this, this saying. Absolutely. I don't have to go defend those datas, or it doesn't do anything to my. The thing is this: I have no pre-canned notion for my credibility to say, please make sure that this is my credibility and it does not get destroyed, and I am now doing things to just support that. That's not the point. Neither am I doing what some of the folks, like some conspiracy theorists, said. I am putting my credibility on the line and I'm going to say these strange things. I am actually just presenting data. I agree with this that I could make mistakes in presenting or interpreting. That is on me, and I've always said misinterpretation, misunderstanding of the data is my problem. You can look at the data by yourself and see how does it look. Adrian says, Dr. Bean would like to hear your thoughts on Morgellons Syndrome. Morgellons Syndrome? Tweet at me. I'll have to prepare it. Mahtab says, the truth is a lion, but it is also lazy like the lion. Hope it was a lioness instead. Truth is, it walks slow, yes. So Luis Grande says, with COVID detected in animals like deer, how long until Luffy's on Luffymectin? So Luffy, actually, it is so funny. I think you're going to like what Luffy's doing. Let me show you. I hope he continues to do this. He's grooming himself. He just woke up. So check this out. So my wife entered from the other door. So he's now looking at her. Hey, Luffy. What's going on? Luffy. Come on, don't. He's so funny. I like him. Were you able to see him? He's sitting there so thoughtful and all. Look at this. He's still focused. Hey, Luffy. Luffy. What's going on, Luffy? He's not sleepy. He's just. Laurie, you're correct. He looks hungover. He's like, he's totally lost it. But he becomes active as well. Texas Meg says, fund Luffy's rehab with Jackson Galaxy. Free Luffy. Yeah, he's actually all chipped and everything. He can go wherever he wants. He does go out all the day. He's still focused at my wife. Okay, so DA says, on day 2 of COVID with symptoms on day 2 of ivermectin, do you recommend all 5 days of ivermectin or cease after 2 days if symptoms cease? I continued. So one day I had a scare that I got COVID and I started with ivermectin. I left it one day and my symptoms came back and I kept it. And then I kept going with ivermectin even longer than the symptoms. Luffy is so beautiful. Yes, he is. Abhijay says, can we Zoom? So not today. We'll Zoom again this Friday. TD says, Luffy flicked the I don't give a switch. Yes. He's actually gone now. Now he's on his activities. Amy says, have you seen the article saying a half or a quarter dose of Moderna as a second shot are as effective in eliciting a response? Could the lower dose cause fewer side effects? In theory, if the response is the same, then the side effects will be the same because the side effects are because of the response. The dancing mom says, regarding unvaccinated data, do we know what percentage of unvaccinated hospitalization deaths are partially vaccinated or those prior to 14 days? We can actually have so number one, straight in the data, that data is not there. But I can, of course, after 14 days is the data that they're saying, hey, 164 million fully vaccinated. That they're already defining as those after 14 days. Now, if you wanted to see how many single dose, we can actually do this. If somebody is interested, what you can do is this following. You can go to, let's say, Bloomberg vaccine tracker. CDC has a vaccine tracker as well. And so I hope they don't block me to say register or log in. But here, if you go to the USA, here, so you can see fully vaccinated, for example, they are saying 352 million doses administered today. Then fully vaccinated are 50% of the population. So if you take 50% of the population of 330 million, let's say 160, and then fully vaccination means 2 doses. So that means out of these 352 million doses, 300 doses or 320 million doses are for these 164 million people, right? So 164 multiplied with 2 is the number of doses that went to fully vaccinating. The remaining are single doses. So for example, here 52, and then, so there is 352 million. So 52 million is 1 plus another 20 million. So 72 million single vaccinated. And as soon as they would spend the time 2 weeks after the second dose, they would automatically fall in the other side. So this 70 million are people, 70 million people who have 1 dose and have not reached the second dose yet. And they are counted in the 167 million. So that 167 or whatever million we discussed, in that this 70 million 1 dose is part of it. Ditching the Grind says, Dr. Bean, I recommended ivermectin to a local radio host, male, age 55. He's pretty sick. Doctor just ordered chest x-ray, not sleeping, bad migraines, went away. He's avoiding ivermectin day 5 or day 7 at home. Ivermectin is an important drug. Doug says, Luffy, cat got your tongue. Yes. That actually did happen because he became upset with the cats outside, and that ended up having him have the medicine. So then the tongue went away. So it is the cats who got his tongue away. Melissa says, Dr. Bean, to expand on FDA approval for vaccination, which will make it open to examination, etc., could it also open it up for being mandated upon that approval? Yes. Yes. All the goods and bads attached to that. Yes, you're correct. So culturing resilience says, does the data include you presented earlier, include comorbidities breakdown? If not, how do you interpret those results? So the first data points by CDC did have comorbidities and a little more data for age and gender and such cases. Second data point does not have it. And the only curiosity for me is that I'm sure that they have that data somewhere. So is that publicly available or not? If available, we may be able to go inspect it and see all these parameters are there or not. If not available, then that will be bad. And my gap today is that I did not go. It already took me 3-4 hours that I could not go and find more, and we were at time. Arun says, how child vaccine is different from adults? I don't think it is different. I hope what you're saying is, are children going to get a different dose than adults, a different window of time? I don't think so. So Rizobert says, please pretend ADE is possible. Would ivermectin prevent ADE? Okay, let's do that. I'm going to draw it. So let's say ADE is possible, and there are many mechanisms. I'm just going to use one mechanism. So let's say here is the a cell with ACE2 plus a cell with gamma FC gamma receptor. Now for the ADE, the antibody attached to the antigen has to bind here. And then this whole complex is brought in, and that liberates the the pathogen from the phagocyte into the cytoplasm, and infection occurs. So now let's see your question. Would ivermectin prevent ADE? So if you give ivermectin, ivermectin can coat this pathogen, and that doesn't mean that the antibodies will not attach to it. Ivermectin cannot be in sufficient quantities to coat every single spike. So there will be some antibodies that are still attached. And so this theoretical mechanism, if we say it is possible, then the pathogen would enter the cell. If it is entering the cell, then the second part inside the cell, ivermectin's behavior of working with the RDRP, 3-chymotrypsin-like protease, importing alpha and beta, nuclear factor K beta, ivermectin would still work on all of these mechanisms, even if the infection occurred because of ADE. So yes, I just had to draw it to kind of walk through this. So Rizobits, yes, if it is even ADE, because at the end of the day, what is ADE saying? ADE folks are saying that infection of the cell would still occur, and actually presence of antibody will enhance the chances of infection. And ivermectin's role, as we know, is to sit in the cell and kind of disrupt the viral enzymes, which are the result of infection. So that means if infection occurs, ivermectin will be there to stall it. So your question's answer is yes. Amy says, if ADE was a problem with the COVID vaccines, vaccinated people would be more sick after infection. They are less likely to die or end up in ICU. Don't worry about ADE. Correct. So that we know, but this was a good philosophical discussion. So logic says, what can we do to lower our chance of Guillain-Barré if we have a high risk of autoimmune disease? Is there anything? Yes. So Guillain-Barré is occurring because the antibodies are attacking the myelin sheath, and there is a possibility of mimicry. So if somebody is taking, let's say, steroids and taking anti-allergies and taking anti-inflammatory for this 2, 3, 4 weeks, then their chances of antibodies going and attacking the spinal cord or the myelin sheaths will be, in theory, less. Elizabeth says, brilliant. Thank you, Dr. Bean. You're very welcome. Elizabeth says, makes sense. ADE would allow COVID into the cell, but not to. Correct. So, I mean, once the virus is inside the cell, then the rest of the function is virus's own job to replicate, and ivermectin kind of interferes there. Roller girl says, yay, drawing. Yes. Joshua says, have you done a video on prior infection, people getting one shot of Pfizer J&J and getting a nice antibody boost? Thoughts, thinking in case my job requires a jab in the future. So I have done one talk. This was a UK study where they said somebody who was infected and then they got one jab or the other and the result. That's one. Second is, that may not be relevant to your question, but still it had the jabs after some time. The second is the study from UK with the distance between the jabs. Now, if I go back to your question, prior infection, people getting one shot. So this I have done. And the the researchers had shown that after first shot, the immune system boosted, and after the second shot, it didn't do much difference. So that means prior infection and one shot is as good as two shots of a vaccine. Bones to G says, missed my super chat. I'm so sorry. Tell me your question again. Let me go find your super chat. It's not nice that the super chat is lost. Where is it? Bones to G, please type it again. So HumbleBeen says, according to you and based on your analysis of the data, what does the Delta and Lambda variant change in the global landscape? The Lambda didn't do anything. I did a talk all about Lambda, and Lambda isn't really doing much other than the area in which it kind of became more prevalent. Delta, you can see, has sped up the pandemic. In a way, Delta has sped up at a time when there are less people available to it who are more vulnerable because they got vaccinated or had been infected and recovered. So even when it is zipping through the system, generally it is going through those who are younger, healthier folks. But as you saw with the data today, it is still causing a lot of damage. So I'm still looking for your question and the missed super chat. This is Luffy. James says, in past video, you showed vax versus unvaxxed hospitalization. Since Delta is now most prevalent, I'm curious if the data showed those rates, but only Delta, or if you just looked at last month. No, so the data that I looked at from January till August. And so the first chunk of data was January till April 30th. The second chunk was May till August. But of course, it contains Delta as well. So I'm going to answer this question, and then I'm still going to find the question for the super chat that I missed. Safia Shabazz says, thanks for being balanced, honest physician. I tried to practice medicine in a similar way. So far, so good. More than a year, and nobody we treated has needed ICU or died. Last one, who never called us. Very good. Congratulations for doing a good job, and congratulations for saving people. So I saw that question again. Sorry. Let's see if I can go find it. Here. Bones to G. I had asked if there were any updates to the numbers from your last pregnancy video. My sister is at 14 week. What would you do? So no, I don't have the numbers updated yet. 14 weeks. She's actually, if she had been vaccinated before, she's still in a very good, safe time. Number one. Number two, there was no change in pregnancy status because of vaccination. And as the months continue to move on, the risk, if there was any risk, number one, they showed there was no risk. And if there was any risk generally continues to go down. So my conclusion from that data was that vaccine is not risky. HumbleBeen says, to what, except ivermectin, would you attribute the decrease in new cases? I think primarily it is ivermectin. And then in addition to that, masking, social distancing, many other things, even some contribution from vaccine, very tiny. But it is people being wise to protect themselves and ivermectin. Gift says, Gift 24 says, Luffy wants to be on when all this mess will end and who's making millions. People have made billions with this. So I think Luffy may want to change his fandom and go there. Soma says, is clot from wax more common in young women? If yes, then it is at high estrogen level in blood in certain menstrual cycle, cause platelet activation and cause more prone to clots. So Soma, I did a detailed discussion about the mechanism. I think the video's title is um, how does clotting occur in vaccinated folks, something like that. Or researchers have found the mechanism of clotting with vaccine. So please check that out. At least that is one of the theories which is very plausible that we discussed. It's not about the estrogen levels. This was a misconception, that was no pun intended, that was in my opinion propagated and promoted by the vaccine folks to just blame the women, to say it is your hormones, or just blame the nurses to say you were injecting in the blood vessels, which was not the case. So we are at 8 o'clock. Let's see. I saw one more. I feel bad if somebody's super chat is missed. So how about we stop for today? We'll continue our discussion tomorrow. If you have a specific comment, for example, I'm trying to work with Rima to talk about vaccination and what are the care one can take when going for vaccination. If there is any other topic that is near and dear to your heart and is important, please tweet that at me. There is a list of topics there as well. I'll look into those too. Eric says, just a follow-up from a previous round. Have you seen data, trials or just observational, specifically looking at efficacy of flufenactins on Delta? Not specifically. So I'll have to look for it. I probably didn't even look for it. But to me, it has not made any difference for my patients. Copied often says, thoughts on vaccine escape. This statement is also copied. Copied vaccine escape. So look, we can decide what is a vaccine escape. The escape that these folks have been saying, these escapes are not correct. These mechanisms are not correct. But for example, if you look at Delta is like a thief that runs in a house and before the people wake up causes damage and runs away. That is sort of an escape. So you can say Delta has learned to cause more damage before the immune system wakes up. But still, did it escape the vaccine? You can see from the data that we presented today, vaccines have taken care of Delta very well as well. So the other escape, where vaccine generated immunity causes people to become more infected or causes them to not respond to the virus or to cause them to somehow create variants or to cause them to start shedding something, that all is not correct. Nice. Gorodok says, my teen and myself did not get reinfected when spouse was sick 11 months after us being infected. Forced to vaccinate, is J&J our best choice since we don't have extra protection? So J&J in women under 50 causes problems. Clotting being one of them, continuous production of antibodies like my wife is experiencing, and then side effects with that. Now, I do not know if it happens in everyone. I'm sure it is a small percentage. So J&J for women is a little more risky compared to messenger RNA. So it really depends upon the gender and age. Chris says, I am in Australia. We have a limited supply of vaccine. I can wait months for Pfizer to take AstraZeneca now. I'm healthy, 35 years old. I know you are anti-AstraZeneca. No. Anti-AstraZeneca for women under 50 because it can cause clotting. Actually, messenger RNA vaccines under 30 are not good. So I think above 30, AstraZeneca is a good choice, not bad. I love this. Carol Ann says, Delta needs its butt kicked by a big Doberman in the house named Ivermectin. Yes. All right. So let's wrap it up for today. There are more questions. There are so many questions. Richard says, is there a difference if someone taking 6 tabs of Lymphocyte once a week wants to take the one daily with the 7th day off? 6 tabs once a week, the one daily with the 7th. No. So one daily, dividing 6 into 1 day each, that is, let's say it is 3 milligram. Dividing it to 3 milligram daily is not going to work because the half-life is 18 milligrams. So it would never reach therapeutic levels. So maybe dividing it within 2 days or morning and evening, those kind of divisions are possible. Rondon, good question. What are the first symptoms of Delta to pay attention to initiate the FLCCC? So we are seeing that the Delta is causing upper respiratory tract infections more, or symptoms more, even runny nose more, and then headache and others. So I have done a talk about the symptoms as well. So headache, fever, dry cough. Some people don't even have cough and they have fever, headache, and fatigue and myalgias. Some people have GIT disturbance. 4% used to have GIT disturbance, now a larger percentage. Some people just have headaches. Eye irritation is common as well. So let's wrap up for today, and we will continue our discussion tomorrow. Please like, subscribe, and share. And if you like this work, you can support it as well. There are 3 links in the description, and you can use them to support it. There are some more questions. Let me just very quickly see if I can. HumbleBeen says, how much success are we attributing to the vaccine that should be attributed to seasonality? Not much. So seasonality for this virus is not a particular issue because we saw the whole last year. And it didn't really care for the season because people were just available to it. It would become more seasonal once people have become infected and cured or vaccinated and cured, and then a smaller number of people every season will become little more prone by, let's say, developing other infections, and then it can become opportunistic as well. At this moment, it's not in that state. It has the whole wide world open to it. Luis Grande says, US said that they were going to release formula to have other poor countries to produce vaccination. Has this happened? It seems like there are still a lot of countries without it. No, I don't think so. Although patents are available, they are public property, so people can see them. Moderna had said that we will not ask for licensing during the pandemic, so people could produce Moderna-like vaccine, at least during the pandemic, and Moderna would not ask for a cut or commission. At least that's what I understand. And once the pandemic is over, then they can say, okay, fine, no more vaccine, we will not make it. Lonnie says, so sad to hear about so many side effects. Thank you for your presentation and careful, understandable answers to our questions. You're very welcome. So if you heard the whistle, this is not my wife whistling at me. I'm not that lucky. This is she playing with Luffy. Okay, so let's stop, and I would see you tomorrow. Please like, subscribe, and share, and all that things that I repeat usually. All right, see you tomorrow. Bye-bye. Sean says, thank you, Coffee and Me, for all the good work you do, helping people like think critically, be curious, and willing to share. Much respect. Thank you very much. Bye-bye for now.